question is, how will you manage a status epilepticus patient in case of like what we usually see in hospital setup? What happens when the patient starts having status epilepticus at home? So what will you suggest to the parents and the family members there? How to proceed with that?
Right. So if a patient is throwing, so I wouldn't say, see, right now they would know if it's status or if it's not status. It's just an epilepsy. Patient is throwing fit. Patient is throwing seeds. When they start throwing, so I'll give you actually a very funny story. I'll tell you right now. Yesterday, I had a patient. We were sitting, so we were all sitting in the corridor, and there's one patient who sat on his chair, and he was staff of our hospital. He screamed, he had an episode of seizure, and he fell on his face, and he had a cut. Immediately when he fell, we all went and we started. Not me actually, all the people around, all the attenders who were waiting in the queue for OPD, they went, and what they started doing is they started putting in their patient ke haath mein, they started giving chappal, they started giving key. So these myths that is there, and then they started doing all that. So then we as physicians, we were like, no, that's not the protocol. We actually told them, move away. We have to, educate the family members, number one. We have to educate the society, number one, because it's a myth. The patient will be lying aspirate and he'll die. And then what, I mean, all these myths, it just leads to death basically. So as you asked, at home, what do you do? I would say that the attenders first have to be educated that when a patient is having such an episode, the patient has to be first put in the left lateral position, and the tongue should be out, because there are chances of the tongue to fall back, and there's chances of aspiration. So so these things have to be educated to patients to patient attenders who already know that the patient will be having. But if the patients who throw fits in the first go, they should be brought immediately to the hospital. There is no home care cannot be done for patients who have status. I feel so, because there are chances of complications. You have to keep an eye on these patients. Home remedy is not, unless and until if the patient can't travel, especially if they're handicapped or they're disabled or children or illiterate patients. We say home remedy also can be done, but I would prefer the patient to be shifted to the hospital, because any complications can be handled at that point, right?